Scott Long here with another episode of We Dose of Radical Transparency. On this episode, I want to revisit a theme I've mentioned before and bring some additional context to reiterate the point. I've mentioned that unlike nearly every other aspect of managing employer-sponsored healthcare, the service you pay for with a traditional pharmacy benefit manager is typically incredibly difficult to determine how much is paid for each service. I've also mentioned that because of traditional PBM's incentives to maintain status quo, they will provide transparency and disclosure only as demanded by the clients, you, the plan sponsor. Let me put into context how important understanding what your PBM is doing for you and the price paid for the service. Take medication adherence in PBM outreach, for example, and diabetes as a chronic condition to consider. 1 out of 10 adults has type 2 diabetes, and chances are you have a variety of plan members who are managing this chronic condition. Many project in 20 years' time, it will actually be 1 in every 3 adults will have type 2 diabetes. There's little question that adherence to medication prevents long-term effects of diabetes. So understanding what your pharmacy benefit manager is capable of with respect to identifying therapeutic gaps in care and outreach to plan members who have fallen off care path is critically important, as well as actually knowing what the cost of this service is. The consequences of medication non-adherence are not only poor clinical outcomes, but also unnecessary healthcare costs. Unnecessary healthcare costs that ultimately hit your health plan. Simply put, the total cost of estimates for non-adherence are staggering. I must reiterate this point. The agreement you sign with the PBM is the exact opportunity that you have to understand what services are available and how you can leverage them to mitigate costs and understand the cost for that service. Bottom line, transparency into price is an absolute must. If you're interested in this concept of transparency and want to learn more, we offer a contract health assessment through our Apex RX program. You can look in the description for the link to our Apex RX program, or just reach out to me at slong@apexbg.com. You can always find me on LinkedIn too.